We're here with Dr. Mustafa Aman, who's the Director of Bariatric Surgery at the Guthrie Weight Loss Center, and today we're talking about bariatric surgery. So I'm just going to have you start and tell us what the types of bariatric surgery that are offered here at Guthrie.
Well, sure. There's several different operations that are offered for weight loss. Probably the most common one that's being performed right now is a laparoscopic sleeve gastrectomy, and that's an operation that's designed to reduce the size of a stomach and make it into a long tubular-shaped stomach. It helps the patient feel full quicker, and it also decreases the patient's hunger. The other operation that's performed at Guthrie is the laparoscopic Roux-en-Y gastric bypass. It's probably the one that most people are familiar with. The gastric bypass has been around for a long time, and that operation works in two ways. We restrict the size of the stomach into a small pouch, and then we also bypass the first portion of the small intestine. And the net effect of that is that allows the patient to lose weight through two mechanisms: by eating less, because the patient gets full sooner with the smaller stomach, and then by absorbing less of what they eat because we've bypassed the small intestine. And then another operation out there is the laparoscopic gastric band. This procedure involves placing a band around the upper portion of the stomach, thereby restricting how much food and liquid the patient can intake. So those are probably the most common weight loss procedures. We also do revisional bariatric surgery for patients who have had prior bariatric surgery elsewhere.
Now, what sets your bariatric program apart from all the other programs within the area?
Well, that's a great question. One of the things that we think is unique about the Guthrie weight loss program is that we are a truly comprehensive surgical and non-surgical weight loss program, all housed in one facility. So our program offers services of a bariatric surgeon, myself. We have a bariatrician, that's a medical weight loss physician. We also have a dietitian, a fitness specialist, a clinical psychologist, trained bariatric nursing staff, and so really is a comprehensive team approach to the care of the patient. That's something that's very unique in the area, and we're one of really only a few in the region that have such services. The other thing that's unique to our program is that we can work with patients at any size. We've worked with patients who have BMI as high as 70s, 80s, and 90s, and we really can find a solution that's effective for all patients. In addition, we offer extensive support for our patients both before and after surgery. We work very carefully in terms of counseling and education to make sure our patients are prepared before the surgery and have lifelong support after the operation. And finally, that one-on-one piece where our surgical program coordinators can really focus in on that education that the patients need to be successful both before and after surgery.
To see this segment again, you can head to our website, that's wbng.com, or if you want to leave a comment or ask a question, just call 584-7362 or 5847-DOC.